In England, if you need help and support with everyday tasks like cooking, washing or dressing, your local authority has a legal duty to carry out an assessment to find out what and how much help you need. The assessment also gives you the opportunity to explain what care and support you feel you need to make your life easier and to enable you to live as independently as possible. Anyone can request an assessment regardless of their income and savings or whatever their needs are. There's no charge for it. People who are caring for someone with needs are also entitled to their own carer's assessment. The care needs assessment must be done before a financial assessment or means test can be carried out to see who will pay for your care. Local councils have their own assessment procedures, but they all follow the same set of national criteria to decide who is eligible for care and support. Just to be clear, the care needs assessment is focused on any social care needs you may have. A local authority cannot legally provide nursing care, as this is the responsibility of the NHS. But a care needs assessment should involve local authorities and the NHS working together to identify if you have healthcare needs as well as social care needs. Check out my video on the difference between health and social care and who pays to find out more about this. So, how do you apply for a care needs assessment? First of all, you or someone acting on your behalf should contact the Adult Social Services Department of your local authority. Explain that you need help and ask for a care needs assessment. Sometimes the care needs assessment is referred to as a social care assessment. Sometimes a local authority can begin to provide services before a care needs assessment has been carried out if they believe you need support urgently. If this is the case, a full assessment will take place as soon as possible to make sure the right support is in place. The care needs assessment is carried out by care professionals from the relevant local authority's social care department. Your assessor may not necessarily be a qualified social worker, but they should have the relevant skills, knowledge and competence and be appropriately trained. The assessor should also talk to other professionals who care for you, like your GP or nurse, to make sure they have a full picture of your needs. The assessment won't always take place face-to-face. Sometimes it's done by phone or using an online or paper questionnaire, which is known as a supported self-assessment. However your assessment takes place, you should be able to fully participate in the process. Where your needs are not straightforward, it is best to ask for a face-to-face assessment. You can nominate anyone you like to come along with you, or your local authority should arrange for someone to help if you need support. This person is known as an independent advocate. When it comes to how long it takes for an assessment to be booked, there are no specific timelines, I'm afraid, but the guidelines say it should be carried out in an appropriate and reasonable time frame, which will be based on how urgently you need care. Most local authorities set their own standards, which are published on their websites, and this generally leads to assessments being arranged within 28 days and agreed services being in place within a further 28 days. I know that these timings have been affected by COVID recently, so there may be a backlog in your local area. The assessment takes at least an hour. A social care professional will look to assess how well you are managing everyday tasks. They will assess care needs against the national criteria, which includes the emotional and social side of your life, your skills and abilities, your personal views, religious and cultural background and support network, any physical difficulties you may have, and any health or housing needs. Importantly, they also take into account your needs and wishes and what you would like to have happen. And finally, if you have a carer, then their needs and opinions are also taken into account. After the care needs assessment, you will have a financial assessment, which is also known as a means test, to find out who will pay for the care that you need. Take a look at my video on this, where I'll put a link in the description below. A care plan should then be agreed, and you will be given a copy. This will detail the care needs the local authority have identified, what help is needed to meet those needs, what it will cost, and how much, if anything, the local authority will contribute towards those costs. The kind of support you may need includes practical support at home, like reminding about medication, doing shopping or laundry care, washing, dressing, or simply supervision, disability equipment, home adaptations such as stair lifts, mobility aids, or maybe care in a residential or nursing home also would include respite care. Some services are free to everyone regardless of the outcome of your financial assessment. This would include information, guidance, or advice from the local authority. They will also help with arranging access to local care services. They'll provide a carer's assessment, equipment and minor adaptations to your home, up to the value of £1,000. Some care services provided under the Mental Health Act, and up to 6 weeks of support services after being discharged from hospital to help you stay independent. If you're not happy with any part of your assessment or outcome, you can request a review. And if you're still not happy with your local authority's response, you can contact the local government and social care ombudsman. Thanks for checking out my YouTube channel. I'm Justin King. My aim is to help people live successful lives, and that often involves understanding your money. I hope you've enjoyed this video. If you did, please press the like button to help more people like you find my channel, and check out the notes for some useful links on the things I've discussed in this video, and for links to other videos on finding and funding care in later life. For now, I'm Justin King, helping you live your best life.